Welcome to Children's Center Thunder Bay. We are very pleased that you have chosen our center to work with you and your family. Children's Center Thunder Bay provides quality children's mental health services in order to improve the health and well-being of children, families, and our community. We have staff trained in a variety of areas, such as social work, psychology, psychiatry, speech and language, early childhood education, child and youth work, developmental service work, nursing, and occupational therapy. If you are starting a program with us, you may meet with one or many of our workers. In your first meeting with your assigned worker, you will be asked to provide your consent for services by signing a consent for services form. This form is like a contract where you formally agree to work with the Children's Center. Before you sign this form, we want to make sure that you are aware of some very important information about agreeing to receive services at our center. This video was created to highlight the main points on the consent for services form. You are still encouraged to ask your worker questions if you need clarification about any of this information. As a client of our agency, you have certain rights and certain responsibilities. Some of your rights include being treated with dignity and respect and without discrimination, getting help in the language that you speak, confidentiality and privacy, receiving services in a safe and secure environment, taking part in planning and reviewing your treatment, accessing your records, file information, and copies of reports, determining if and when other service providers have access to information about your treatment, talking with us if you feel any decision or treatment approach is not right for you, making a complaint about services or providing other feedback, and altering, limiting, or withdrawing your consent at any time. Additionally, we will respect and accommodate your cultural background, uniqueness, and diversity, and will work with you to provide accommodations to address and reduce any barriers or obstacles to your participation in services. Please feel welcome to discuss your specific needs with your worker. Your responsibilities include providing us with the information we need to offer you the best service possible, providing us with up-to-date personal and contact information, attending and participating in treatment to the very best of your ability, informing us as soon as possible if an appointment must be canceled or rescheduled, and treating staff and others with dignity and respect. Confidentiality and privacy. You have the right to confidentiality and privacy when receiving services. There are a few circumstances where, by law, we might be required to share your information without your consent. These include where we believe there is a risk of suicide or serious physical harm to another individual, where there is suspicion of child abuse or neglect, if ordered by the courts to release information, or if we receive a police request to help find a missing person, in a medical emergency, when required by the provincial government, where we become aware of sexual abuse by a regulated health professional, if there is a suspicion of someone being mistreated in a long-term care facility. We will share your information with your permission in instances where you have provided your specific consent by signing an authorization to release information. We will also inform other active service providers when your service with us is completed. Risks and benefits of service. Participating in services can involve both risks and benefits. Your worker will discuss with you the specific risks and benefits of the service you are involved in. Some general benefits include relationships can improve. You may experience improvement in problematic symptoms. You may feel more motivated to change and maintain changes. You may develop more control over your behavior. You may learn about yourself and your strengths. You may see your struggles in a new way. You may develop new skills and learn healthier ways to cope. You may feel less alone and isolated, and your physical and emotional health may improve. Some general risks include some family members may not participate in treatment. Some people may not support you in changes you are making. Change can be uncomfortable, difficult, or frightening. Things may get worse before they improve. Others may not notice the changes you are making. Change may not occur even if you are trying really hard. And you may learn things that are hard to hear and deal with. Your worker can also discuss with you whether there might be other programs or services suitable to meet your needs, either at Children's Center or elsewhere in the community. Your personal health information. Children's Center complies with the Personal Health Information Act, the Child, Youth, and Family Services Act, and the Youth Criminal Justice Act. All of the information we collect from you and the work we do together is kept in an electronic clinical record and is protected using electronic security passwords. When you are no longer a client of the agency, we will maintain your file information as required by law. Your file information is yours, and you have the right to access and review information about you, correct information that is inaccurate, and control who has access to your information. You will be offered copies of reports written about you. If you have concerns about your file information, please speak to your worker or our privacy officer, Dr. Fred Schmidt. Concerns, complaints, and other feedback. We are always open to feedback, suggestions, and complaints about our services and programs. There are a number of options if you have a concern or complaint that you'd like us to address. You may use the complaint link on our webpage. You may talk to your worker. You may talk to the program manager. You may talk to a director. You may talk to the Chief Executive Officer, Diane Walker, or you may contact the Ombudsman's office at 1-800-263-2841 or by email at cy-ej@ombudsman.on.ca. Evaluating programs and services. We are committed to improving the quality of our services and evaluating how well our services are meeting your needs. From time to time, you may be requested to complete surveys or other materials to help us in this regard. Participation in these types of activities is not mandatory. In our work to evaluate and improve our services, your client information and data we have gathered may be used. However, we will never identify you in our evaluation processes or reporting of results. Missed or canceled appointments. It is very important that you attend all of your scheduled appointments. If you must cancel or reschedule, we ask that wherever possible, you do so 24 hours in advance. An appointment that is missed without notice will be counted as one of your sessions. If more than 2 sessions are missed without notice, your file will be closed. If there are barriers to attending scheduled appointments, please discuss these with your workers so we can work together to find a solution. Use of email and texting. To support treatment services, Children's Center offers the use of electronic communication, including email and text. Email can be used for communication of personal health information to you or when sending information to other organizations or service providers. We will also provide the option for clients to receive text or email appointment reminders 24 hours in advance of a meeting. Please speak to your worker about your preferred methods of communication. Video-based services. At Children's Center, we use both video-based and in-person services, depending on a number of factors. Your worker will speak to you about which methods will be used in your service and will provide you with further information. Please remember to ask your worker any questions you may have about the information reviewed in this video or about services in general. We look forward to working with you.